Hello, friends. I had this very intense experience today in the clinic. This gentleman, aged 53 years, came for consultation for his problem of erectile dysfunction. And I was filled with empathy and compassion for his sufferings. Two marriages, both divorced. He's in a relationship which is also very stormy. He's not settled in any relationship. On top of this, he developed around age of 45 high blood pressure, diabetes. He is a chain smoker. He takes alcohol at least 3 to 4 days in a week. And late nights, sleeping late, no exercise, no physical activity, overweight. And he's asking for a quick fix solution to his erectile dysfunction. Now, as a physician, we evaluate the life space, entire life space and mind space and relationship space of the patient. The struggle, the difficulties, the pain, the suffering, the stress, the tension, and its impact on the body. So blood pressure and diabetes just don't come suddenly on its own. They come due to stresses of life and wrong and unhealthy lifestyle. Now, all these things in background, and he also indulges in casual sex, paid sex, but he finds difficulty of getting erection, and he wants to quick fix that he wants to address his erectile dysfunction with a quick fix solution. He wants instant remedy to his problem. Yes, there is something called Viagra. There are something called intrapenile injections, papaverine injections. There is something called vacuum pump. There is also something called penile implant. But these are not natural and lasting solutions. Whereas the right approach is to understand the underlying factors in a given case of erectile dysfunction, and not just understand it by the physician, but patient has to understand it. Patient has to develop insight in his own life, that how his blood pressure is affecting his sex life, diabetes is affecting, smoking is affecting, alcohol is affecting, lack of physical activity is affecting, the mental and emotional stress is affecting. And once he has a cognizance of this, awareness of these factors, he will start working at it, and he will not just rush for quick fix solutions which are as such temporary. So we get many patients who take Viagra and come to us because now Viagra has also stopped working, or if at all it gives temporary benefit with a lot of side effects and dependence, and they want lasting solution. Now, when would lasting solution come? See, the sexual organs or its functioning is connected to entire body. It's not in isolation, right? It doesn't work in a silo. So, and the body has impact, the fitness of body has impact on fitness of sexual organs. For sexual fitness, you need to have physical fitness. And body has constant impact of our mind. What happens in our mind, in our relationship, in our life space, the stresses, the emotional stress and its impact. So mind and body are connected, and ultimate effect comes on various organs. It can be sexual organ in such case where there is erectile dysfunction. So we also evaluate then sex hormones and various other medical hormonal parameters like prolactin, thyroid, etc. Now, based on this entire assessment, we guide the patient, which patient has to walk on that path to improve his physical fitness, mental and emotional fitness, relationship fitness, lifestyle in terms of nutrition and exercise and sleep pattern. And then there is a lasting solution. So it's very imperative that we need to build that awareness. We as a professional and you as a common man, you need to understand that life is very holistic, health is very holistic. We need to be healthy at all of body, mind, in relationship, in terms of our lifestyle. And then we can actually enjoy a good sex life. So there's no quick fix solution. There's no magical wand, which will just take away your sexual problem while your entire system remains unhealthy. Mental stress remains, relationship issue remains, unhealthy lifestyle remains, stress level remains, BP and diabetes remains. No, it cannot happen. So let this be very categorically clear. In fact, I had an element of pity also, because people live in so much of ignorance with their suffering. The first step is to have the right knowledge. Why this suffering? Why am I suffering? Why am I this physical illness? Why have this sexual problem? Why am I suffering mentally and emotionally? Why am I not stable in a relationship? And how do I approach my life? At much larger, longer, better scale, in terms of long-term solution. So this video is inspired by his current state, where he is totally oblivious of the fact that what problems are leading to his sexual problem, and he's not even ready to understand or address it. So I have started with efforts in that direction. I brought a lot of awareness in him in the first session. Now we are waiting for his blood test, and then after that I'll give him comprehensive assessment. What are his issues at emotional level, relationship level, in terms of stresses, lifestyle, habits, and of course whatever medical parameters are suggesting if anything abnormal. And then we'll have a multidisciplinary approach with various modalities, like long-term solution with homeopathy medicines, counseling, personal counseling, relationship counseling if required, couple therapy if required, which is from parlance of clinical or classical sexology, lifestyle guidance, stress management, yoga. So all this will be integrated and will be helpful to the client. So please always have a very holistic approach to life, health, and solution to your problems. All the best.